Okay, so I want to start by welcoming you all to the sixth of our 8 webinars in the webinar series, the Project Firstline Infection Prevention Essentials series. My name is Jenny Winkler, Director of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association. We're going to take a moment to go through a couple of housekeeping items, and in the meantime, we encourage you to please complete the poll that is opened on the right-hand side of your screen. Results from this poll will only be seen by the presenters and not shared with everyone on the line. After you've selected your answers to the poll, please make sure you click that submit button to ensure that your answers are received. So before we begin, a couple of announcements. So due to the large number of participants on the line, all lines have been muted. We will have opportunity for comment and discussion during today's session. And so you'll be able to take yourself off of mute. To do so, you will click that unmute button in the bottom on the bottom of your WebEx screen. And for those of you that are not on WebEx and are dialed in on the phone, you'll be able to hit *6 to unmute your line. We also encourage you to utilize that chat box on the right-hand side of your screen to add any comments or ask any questions. Finally, I want you to be aware that this webinar is being recorded, and so by attending today's webinar, you are considered to have been consented to being recorded. If you do not want to be recorded, please exit the webinar now. A copy of the slides and the recording will be shared with all registrants following today's presentation and then posted on Chicago Department of Public Health's Healthcare Associated Infection website. So again, welcome to webinar 6 out of the 8 webinars in this series. This webinar series is intended for all frontline healthcare personnel, regardless of their infection prevention training or educational background. These sessions are intended to provide that foundational knowledge that you will need to be able to confidently apply infection control principles and protocols necessary to protect yourself, your facility, and your community. We will be utilizing educational materials from the Project Firstline, which is the Center for Disease Control and Prevention's collaborative aimed to provide infection prevention training. So we appreciate all of the work and all of the efforts you do and look forward to connecting with you throughout this webinar series. So this program is accredited by the state of Illinois for up to 1 hour of nursing continuing education credit, and only those attending the live program will be eligible for these continuing education credits. Following today's webinar, you will receive a survey via email, and you will need to complete all of the required fields in that survey, and that includes providing your nurse license number, the time you joined, and the time you exited today's program. That survey will need to be completed by Thursday, June 9th in order for you to receive those continuing education credits. If there are multiple people in the room with you during today's session, please be sure to send that survey link to those in attendance. Within 2 to 4 weeks following the close of the survey, all of the respondents will be receiving their continuing education certificates from Illinois Health and Hospital Association staff. In addition, all participants in today's webinar will receive a certificate of attendance indicating your participation in today's session. So with that, just want to introduce the Project Firstline team. The Illinois Health and Hospital Association is partnering with the Chicago Department of Public Health to host this series to support your infection prevention training needs. We're also joined by Crystal Bayer, who's an infection preventionist from Advocate Sherman Hospital, who has extensive expertise in infection prevention and is enthusiastic about educating peers about infection prevention. So you will be hearing from all of these team members throughout this webinar series. So the Centers for Disease Control and Prevention's Project Firstline initiative aims to provide infection prevention and control training for frontline healthcare workers and support all of their efforts with applying those infection prevention principles. So there are multiple components to this initiative, and we'll just highlight those really quickly. So the first part of this Project Firstline initiative was around conducting an infection prevention and control learning needs assessment of frontline healthcare workers in the city of Chicago to identify where there were training gaps and needs, and this survey occurred at the end of 2021. The next part is promoting awareness and facilitating the CDC's Project Firstline infection prevention and training curriculum, and that's what we're doing now. So many of you on the line are seasoned infection preventionists, or you've had some type of infection prevention training in the past. And you might find the content of this educational series a little bit basic, and truly it is geared towards building those foundational components for our healthcare workers. So because there's opportunity for discussion during each one of these webinar series, we really welcome and encourage those with experience in infection control to share their knowledge and serve as mentors for those that are in the early learning stages around infection prevention practices. The last part about this program really is evaluating these training sessions, and so we are able to make changes to our education sessions so that we are providing meaningful learning opportunities for all of you on the line. And so with that, we'll go ahead and we'll just highlight today's learning objectives. By the end of today's session, you'll be able to describe why good ventilation is important for infection control, how ventilation works to reduce the germs in the air, and why it's important to work with those in your facility who are in charge of the air handling and the ventilation. So with that, we will go ahead and dive into today's topic, which is ventilation. And so to get started, we're going to talk about the definition of ventilation. So ventilation is the movement of air in and out of an enclosed space. So for example, it's the circulation of fresh air into a room or inside of a building. In healthcare, good ventilation is important to ensure that our staff, our patients, and our visitors are not exposed to any of the chemicals, dust, or other hazards that could be in the air, and also to help reduce the spread of respiratory germs in the facility. Good ventilation improves the air quality and reduces the risks of germs spreading. And so we're going to take a minute to talk about why ventilation is important and learn how it works. So as part of the Project Firstline curriculum, we will be hearing from Dr. Abby Carlson, who is an infectious disease physician at the CDC, and she will talk about ventilation and how it works. So we are required to play these videos as part of this program, but we are committed to helping everyone on the line to ensure that you're able to hear the videos clearly. So regardless of how you're listening to today's webinar, the sound from the videos will be coming through your computer speakers. So participants that have dialed in on their phones will need to turn the volume down on their phone, but will also need to make sure that their computer speakers are not muted and that the volume is up. If you are using a headset to hear today's video, please ensure that the volume on your headset is also up. So these steps will help to make sure that you can hear the video. In the event you are unable to hear the video that's playing, we've dropped a link in the chat box so you can open the video and listen to it at the same time. And if that doesn't work, we're also going to be adding a summary of the video in the chat for your review. So with that, give me one moment and we will go ahead and we will start our video about what is ventilation. So as we heard, Dr. Carlson shared a lot of information and really highlighted why ventilation is important in healthcare. Ventilation removes the respiratory droplets and the germs, including the virus that causes COVID-19 from the air. In enclosed spaces, ventilation systems will remove all of that old air that's filled with the viruses and particles and then exchange it for new air. And these are called air exchanges. And we'll talk a little bit more about air exchanges later in the session. And for rooms in healthcare facilities that don't necessarily have these ventilation systems in place, that air can still be cleaned by using a filter that usually sits in the corner of a room and filters the air to remove those viruses. So again, we're gonna take a look at two videos that really highlight how air circulates in an enclosed space and still continues to demonstrate why ventilation is important. So we're just going to play these videos quickly. They don't have sound, so don't worry if you don't hear anything. So this first video shows what happens in a room without ventilation. As you can see, without any ventilation, as the healthcare worker breathes, their respiratory droplets linger in the air for a while. And over time, those particles that are in the air will settle onto surfaces. And this is what puts people at risk for picking up, germs and viruses. On the flip side, this next video shows a room that has good ventilation. And as you can see, this video shows movement of the air in and out of the room. The healthcare workers are removed from the room. And so you can see as you're watching this video, the new air is cleaned and pushed back into space. So this continues to emphasize that important piece about having strong ventilation systems in healthcare and how they play that important role. So we're going to pivot a little. We've talked about what ventilation is, and we're going to talk now about why it is important and how it really does play that role in infection control. And so as part of this, this next section, we're going to hear again from Dr. Abby Carlson at the CDC, who will talk about why ventilation matters. So again, we're required to play these videos and are committed to helping everyone on the line. Hopefully you were able to hear the last video, so make sure the sound on your computer speakers is turned up. If you're using a headset, make sure the sound on your headset is up so you can hear the video. Again, if in the event that you can't hear this video, we will drop a link to the video in the chat so you can click on that and watch at the same time. And then also, if that does not work, we will add a summary of the video in the chat box for review. All right, so with that, we will hear again from Abby Carlson. right. So Dr. Carlson shared a lot of information about why ventilation is so important and why it matters. And just to highlight a couple of those key takeaways that she shared. So an air exchange is the time it takes for a room's old air to be completely replaced with new air. And in healthcare, almost every single room in your healthcare facility has a number of recommended air exchanges. And we measure air exchanges by the hour. So we think about how many times per hour the air in that room is replaced. It's important to know how often that air in that room is being exchanged or cleared, because that will tell you how long a room should sit empty after a patient leaves before another person comes in without wearing any PPE or a respirator. You can still enter a room as long as you're wearing PPE as before the air has exchanged. And of course, make sure you're wearing your PPE if you're entering anytime a patient is still in the room. Without PPE or without wearing that PPE, that wait time is really important. And so it's something that, is recommended. You wait for that entire air exchange before entering a room. In healthcare, it's also important to understand that ventilation in one patient care area is affected by the ventilation in another area and affected by another, and so on and so on. So before making changes to air handling or ventilation in your organization, it's important to work with those experts in your facility so that air movement isn't affected in the wrong way. Ventilation is very important in healthcare, and it's one of those strategies that we have to keep germs from spreading. So you want to use it appropriately and correctly to make sure that the air is clean. So as we talked about in one of our previous sessions, there are a handful of modes for virus transmission. And those different modes are highlighted here. And understanding the different modes of virus transmission is important because it helps us to understand the role that ventilation plays in healthcare. So we're going to highlight these just real quickly. So to start with, that first mode of transmission is the fomite transmission. And this occurs when an infection is spread to a susceptible person through direct contact with the surface of a fomite. And that is something that's a non-living object. So that could be like contact with a stethoscope, a blood pressure cuff, or any type of medical equipment that's contaminated with infectious material. Another mode of transmission is contact transmission. And this is when an infection is spread by direct contact or touch from an infectious person to a susceptible person. And a couple of examples of germs that are spread this way include methicillin-resistant Staphylococcus aureus, or MRSA, or vancomycin-resistant Enterococcus, VRE. A third mode of transmission is the droplet transmission. And so this is when splashes or sprays can occur from an infection, from a person with an infection. So whether that person coughs or whether they sneeze, they create droplets, and those droplets can carry germs short distances. And so that's up to around 6 feet. So these germs, these respiratory droplets, can land on a susceptible person's eyes, nose, or mouth, or on top of surfaces in healthcare facilities, ultimately causing infection. Examples of viruses that are spread through droplet transmission include COVID-19, influenza, or pertussis. And then lastly, a mode of transmission that occurs is airborne transmission. And this is when germs are aerosolized into tiny little particles, and then they survive on air currents over great distances. And these tiny little particles, these tiny little germs, can be inhaled by a susceptible person and spread disease. And so some of the diseases that are spread through airborne transmission include tuberculosis and measles. All right, so we'll talk a little bit about ventilation in healthcare. And so if ventilation is part of your role in your facility, we would really invite you to chat in what you do, or if there's anyone on the line who's willing to unmute and share a little bit about their role in the facility, that would be great. You can click the unmute button on the bottom of your screen, or again, just chat in, your role with ventilation in your facility. Healthcare facilities have regulations around the design, the construction, the maintenance, and the monitoring of their ventilation systems. And recommendations for those best practices come from the American Institute for Architects. And so just a couple of those regulations to highlight, just so you're all familiar with some of these regulations. So the first is inspecting of filters in your ventilation systems to ensure proper operation. The removal of bird roosts and nests near air intakes in healthcare facilities. And this is important because that prevents the spread of germs and they prevent those germs from entering your healthcare facility. Regular cleaning of air duct grills in rooms when they are not occupied by patients. And this is an important practice because it prevents dust accumulation in our patient care areas. Other recommendations include coordinating ventilation system maintenance with infection control staff to ensure, if it's necessary, relocation or accommodations for any immune compromised patients in the facility. Also, regulations around the regular completion of infection control risk assessments to ensure that your facility has appropriate ventilation practices in place. And so infection control risk assessments are tools that are used to assess a facility's infection prevention practices and also to guide quality improvement activities to help identify or correct any of the gaps that are identified in infection prevention practices. And lastly, regulations encourage you to work with your experts in your facility to ensure that the number of air exchanges are occurring in patient care areas. And we'll talk a little bit about that in a minute. Because we want to make sure that in our facilities, we are taking steps to ensure good ventilation. And so again, going back to air exchanges. So air exchanges, again, as we have mentioned a couple times, are measured in hours. And they reference the amount of time it takes the air in a room to be replaced with new or filtered air. And so you've heard a couple times now, nearly every type of room in a healthcare facility has a recommended number of air exchanges. And so one example would be that the recommendation is 12 air exchanges for emergency department waiting rooms. And so that means the air in an emergency department waiting area will be removed and filtered or replaced 12 times over an hour. The recommendations for air exchanges come from the American Society of Heating, Refrigeration, and Air Conditioning Engineers. And there will be a link to the guidelines at the end of this presentation and in today's follow-up email for what those air exchanges are. I do want to note that there is a fee associated with downloading the most up-to-date recommendations. So if you have any interest in reviewing those air exchange guidelines, I would highly encourage you to reach out to the experts at your facility as they likely already have access to that information. Understanding the air exchanges is also important because, again, as we've highlighted a couple times, it tells you how long a room should remain empty after a patient leaves and before another person comes in without wearing PPE. It's also important, and again, we've highlighted this a couple times, but you don't want to take steps to improve the ventilation in your facility on your own. So things like opening windows or blocking or redirecting the vents can change the balance of the air pressure and the ventilation in other spaces in your facility. So you always want to work with the staff and the experts in your facility who are in charge of ventilation systems if you have questions or if you think there are changes that need to be made. Okay, so with that, in just a moment, we are going to break up, or we're going to split up into breakout rooms, and we're going to talk through the questions that are listed on this slide. So you can see, if you have questions about ventilation, we can talk a little bit more about who you would speak to and some examples, who you would talk to in your facility, and then how you maintain rooms used to care for patients with respiratory diseases like COVID-19. So each of the breakout rooms will have a Project Firstline team member serving as a moderator, and we're going to have 15 minutes to discuss the questions on the slide. At the end of our discussion, the groups will come back, and my colleague Christina Boyd from the Illinois Health and Hospital Association will walk us through the highlights from our group's discussions around these questions. Again, encourage you to share and keep in mind that there are a variety of healthcare providers with varying levels of infection prevention experience in your breakout room. So we'll hear a lot of a variety of different ways that facilities use ventilation to prevent the spread of viruses and COVID-19. So with that, in just a moment, you will see a pop-up window in the middle of your screen asking you to join an assigned breakout room. If that does not appear, you can hover your mouse over the menu bar at the top of the screen. If your menu bar is hidden, you might have to hit Alt Enter to come out of full screen mode, or you can click on the tab where it says Show Menu Bar. You'll highlight the option for breakout sessions, and then you will scroll down to the option that says Join a Breakout Session, and then you can pick a room that appears on that list. So with that, we will go ahead and split up into our breakout rooms.
Hello?
I'm manually signing, so if you guys are unable to find your breakout session or the option to choose a breakout session, so the first issue might be that you are in full screen mode. So Alt-Enter to release from full screen mode. From there, you want to look at the top menu bar up on top, and that will likely say show menu bar if it's not shown. Otherwise, you can go to breakout sessions and then pick from the list of options. It's basically breakout session 1, 2, or 3. They are not split up by facility type. For this session, it is basically just 1, 2, or 3, but I am working through the list. So if you can just stay patient for a second, I will get through everyone.
My God. Oh, I can't even see this, dang it. On.
Okay, so that 15 minutes went by very quickly, and I'm sure there was a lot of great discussion in the various breakout rooms today. So now we're going to take a few minutes to hear highlights from each of the groups around their discussions on ventilation. So with that, we'll go ahead and start with group number 1. That was Jenny.
Thanks,
You might be
Christina.
on.
There we go. Yeah, sorry. So our group was great. We had a mix of folks from acute care hospitals, skilled nursing facilities, home health, and outpatient clinics. So, we learned that, a lot of managing COVID patients We use droplet and contact precautions. We have the door closed in those patient care areas. For our outpatient clinics, of course, that was a little harder. And so screening patients for COVID before they come into the facility was also important. And then not cohorting patients that have COVID in our facilities was also important for maintaining rooms and care for patients. So we appreciated everybody's participation. So thanks.
Perfect. Thank you, Jenny. How about group number 2? I believe that was Kim. You want to go ahead?
Sure. So we had a nice discussion about the air exchanges in facilities. We had some assisted living questions, more on where the patient rooms aren't normal patient rooms. They're more of like little apartments or little studios with like little kitchenettes and their private bathrooms, things like that. So, just trying to figure out what's the best scenario, how do they keep the proper air, and allow fresh air and, circulation and not have this stagnant, stale air in the room all day long, and what's the best options for them. And then just, talk about what is negative pressure, neutral pressure, positive pressure, what those types of rooms are, and examples of such. But yeah, so we had a good discussion. Obviously we ran out of time, but I think we could probably talk all day.
Perfect. Thank you, Kim. You guys did have a lot of great discussion in that room. I was kind of popping in and out. Let's see, the third group, that would be Allison. You can go ahead.
Great. So we discussed, where to go with questions about ventilation. So that was pretty much a consensus of talk to your building engineers and your facilities team. They're going to be the best people to help you with the air exchanges. But if you're uncertain about the air exchanges in a room, just go with the minimum requirement to be safe. And then we also had a great example of some challenges people have been facing with maintaining ventilation. Like, for example, if you have patients in certain settings, like blocking them because they're cold, and going through some good examples there about how to address those challenges.
Perfect. Thank you so much. All right. Well, thank you everyone for participating in the breakout sessions today and for sharing all of this great information. It's a great way to not only hear about what others are doing around this topic, but also vital to understanding the importance of ventilation in your daily role and within your facility. So we hope that you have learned a lot today. This slide highlights some of the key learnings from our discussion, including the importance of having an understanding of how ventilation plays a role in infection prevention. This slide just highlights what you are going to see in our upcoming sessions, as well as the broader themes and topics that are covered in the Project Firstline materials. There is also a link to register for future webinars that you are welcome to pass along to other colleagues who may be interested in this content. As you can see, the information covered in these sessions is geared towards frontline healthcare workers. So we do encourage you to share the webinar opportunities with those staff members in your facility who are, working the front lines with you. Okay, and then finally, this slide highlights the different resources available on respiratory protection and source control. We have also included the website for the Chicago Department of Public Health, where you can find additional healthcare associated infection resources, as well as the recordings for each of these webinars. We want to thank you again for attending today's webinar. If you have any questions, comments, or would like additional information about how you can partner with the Project Firstline team as a mentor for other healthcare professionals, we encourage you to contact us at the email listed on the slide. And then finally, before you sign off today, we do ask that you complete the poll that is open on your screen at this time. It'll be in the same location as the pre-assessment poll that we launched earlier. Results from this poll will only be seen by presenters and not shared with other participants on the line. The results from this poll are used to help us improve future education sessions. And then finally, for those of you who are seeking nursing continuing education credits, you can scan the QR code on the slide now and complete the information in the survey. If you are not able to complete the survey right now, no worries. A link to the survey will be sent out in the follow-up email that will go out either today or tomorrow following the presentation. So again, please complete that survey by June 9th in order to receive your continuing education credits. Again, thank you for your time today, and we appreciate all of your efforts to keep your patients, your colleagues, your family members, and your communities safe. And we will go ahead and leave this poll open for a few more minutes. So as soon as you have completed that poll on the right-hand side of your screen, you are free to exit the webinar, and you have a nice day.